So we saw EVP being presented, so enfortumab vedotin plus pembrolizumab. It seems to be that in this cisplatin eligible population it was tolerated reasonably well. There was about 25% of patients who didn't complete all studies, but that's all treatment. But that's maybe not so harmful for the eventual treatment effect. We didn't get any data for that, but it seems that some patients just cannot tolerate a long period of enfortumab vedotin and have to stop. So it seems that it's manageable. On the other hand, these treatments do have side effects that are different from chemotherapy. We've started to learn to deal with those side effects in the past few years that we've been using these types of drugs, but that's definitely something to still pay attention to, especially if you're going to give the full regimen of perioperative treatment. So that's half a year of EV plus pembrolizumab, and as we've seen in the metastatic setting, neuropathy is common, so there are some side effects that are going to be important for those patients and also important for their quality of life. So I think this is one of the reasons why we do need to look at, can we de-escalate some of this adjuvant therapy? It's at this point too early because this is the treatment regimen used, but I think there should be space to do studies in that setting to de-escalate treatment. Yeah, so I think that's a very important question for the field for the years to come. So we think that with EVP, as we have such deep responses in a lot of patients, and our tools are improving to assess response. So with ctDNA, urinary tumor DNA, we've also used a lot of multiparametric MRIs in our studies, which can also really help in assessing the local situation. And I think with all these tools combined, we can go to a situation, hopefully, where we stratify the consolidation treatment or the additional systemic therapy based on these diagnostic assessments. And in some patients, it might mean that they do not need any further treatment after their first regimen of EVP, and in some patients can have a more limited local treatment like chemoradiotherapy or radiotherapy alone. Some patients who, for example, are still ctDNA positive after their induction treatment actually may need a switch from systemic therapy, and it's in that space that we still have some development to do and still find new drugs that are more effective for these patients.